Hi Barbies. The medication that I want to do for you today is Digoxin. Digoxin is a cardiac glycoside, and cardiac glycosides, you might have heard this in the past referred to as digitalis. It comes from the purple plant called foxglove, and this glycoside term is used for many poisonings. It's really a chemical term that is used to describe many different kinds of poisons. So digitalis or digoxin, if we want to look at what it does, digoxin is indicated for heart failure and for treatment of atrial fibrillation. Let me put my anti-glare. It has an inotropic effect, which means it increases the force and efficiency of cardiac contractions, and that it has a chronotropic effect, meaning that it decreases the heart rate. So, what are some of the side effects? What do we have to worry about? And what do we need to know about what's the goal of treatment? So, I want to say that whenever we're treating heart failure, let's look at the fact that this is not a cure. No medications that we give for heart failure actually cure heart failure. All we're doing is tricking our body into making the symptoms better and reducing the workload on the heart. Okay, so what do we have to remember about digoxin in terms of the side effects? I made you this little picture. So digoxin, in addition to being a cardiac glycoside that does not cure heart failure, one of the side effects that you will see is visual disturbances, and what you'll see is yellow halos. So visual disturbances, I think maybe Van Gogh was on like some kind of digitalis, because this painting reminds me of digoxin with the yellow halos. And you can see this ape is actually doing the painting here, and that is because we need to take the apical pulse for a full minute. So whenever you're assessing your patient, before you give digoxin, take the apical pulse and then hold the medication if the heart rate is less than 60 beats per minute. Alright, so digoxin. Visual changes, we have to monitor for toxicity, and the signs of toxicity include those visual halos. We check the pulse before we administer, so don't administer for a pulse less than 60 beats per minute. Dig levels should be between 0.5 and 2.0. So let's do levels 0.5 to 2.0 if you're just remembering your normals. That's where it should be. Any higher levels than that increase our toxicity. If you do have bradycardia, we treat an overdose with something called digibine. So if you're going to remember your antidotes, antidote equals digibind. Alright, this one is a very detailed medication, but I'm trying to narrow it down a little bit for you. You know what else I'm going to include? There's one more thing I should include. Along with this ape, I'm going to draw you a banana. Okay, I'm going to try to draw a banana. Okay, that's a banana. Because I want you to remember potassium. Because whenever we're making our heart beat harder, it's going to require more potassium. So hypokalemia increases the risk of dig toxicity, so we need to actually increase our risk of high potassium foods. So we need to increase potassium foods when we're taking dig. Alright, so yellow halos, apical pulse, also bananas, you can remember that with the ape, not a cure, and it is a cardiac glycoside. I hope that helps you remember digoxin.